Hi everybody, and welcome to today's session of UpCoach. So it looks like we've got no attendees on today. So what I'm going to do is I'm going to record today's session, and then you're able to watch it at a later date. So okay, here we go. So today we're going to be talking about client funnel. At our last session, we all agreed that we'd talk a little bit today about a client funnel and what's called a treatment protocol. So what I want to do is I want to go through that so everybody gets a really good understanding on how you can apply that to your business and how you're able to use it within the practice to generate not only what I believe better results for your clientele, but also helping increase revenue for you as well. So I believe that it really creates a win-win outcome for both practitioner and client that's getting the treatment. All right, so here we go. So first component is to really understand, first of all, what's the outcome. So what is your outcome? It's really important to understand what do you want to help that client with. So obviously your outcome is to make sure that you're helping the client at the best of your ability. So number one is, what do you want that client to experience? Now, over and over again, I speak to practitioners all over the world, and unfortunately what they do is they've been taught a model that isn't necessarily susceptible, A, to today's treatment protocols, and number two is I believe that it's a model that doesn't take into consideration a lot of different factors. Most people believe that, one treatment, two treatments can pretty much cure everything because they've got a model of A, turn the patient over really quickly, or B, well, that's all you need because it just hasn't been taught. Where you and I both know that, things aren't exactly like that. Why? Because very rarely in all my years of experience with, treating clients and coaching, have I seen that, one or two treatments can absolutely, have that much of a diverse effect that you're healing somebody. I mean, it just doesn't make sense for me. So it's important to ask yourself, what do you want the client to experience? How do you want that client to make sure that they're really getting the best out of it? And once again, look at the word experience. Okay, so when somebody comes to your clinic, to your center, or to your house, wherever it is that you're performing the treatments, what is it that they're going to experience? What are their surroundings? How does your room look? How's it set up? How is their whole experience from when they're speaking to you on the phone or whether making inquiry all the way through to when you're performing a treatment. So experience is critical. Now, most importantly, it's how do you make sure that client goes through a set of a funnel or a strategy to make sure that they're getting A, the best out of the session, and B, making sure they're getting the best out of you as well. So and in return there's an investment that they make in your expertise. So next thing is, what knowledge do you want them to gain? A lot of practitioners unfortunately have this lack of mindset, and they never want to part any knowledge onto their client. Or what they do is they actually treat the client like they're another practitioner and overwhelm them with information that's pretty much to the client useful, to be honest. I've seen this in experience time and time again. So it's no use trying to treat your client like another practitioner because they just A, don't understand that, and B, they don't need to understand that. That's why they've got you guys on board. Third component is, how long do you need them to heal with you? Yeah. So, and this is an important question. I mean, people say, "What do you mean, how long do you need them to heal with me?" Well, it's a logical question. Do you want them to be with you for 12 weeks, 16 weeks, 18 weeks, or is it 1 week as an example? So it's important to understand that. Why? Because you're the practitioner, so you know exactly how long that client roughly. Or not roughly, pretty much, through your experience, how long that treatment protocol needs to be in order for you to have the best effect with that client, okay? So, and to give them the outcome that they're asking you for. In other words, to heal from a problem or a challenge or whatever they may have, or an illness or an ailment, whatever it may be. Yep. So it's important to ask yourself that question. And what are the next steps, post-treatment? This is an important thing. So in your outcome that you want to, share with your client, what happens post-treatment? see a lot of people, think, okay, they'll just treat them, and if there's anything that sort of happens, come on back. But that's a ignorant way to look at things. What happens post treatment? How do you make sure that people don't go back into that habit that they have? Those set of circumstances that they're in that got them there in the first place. So if it means that it's about continuing their training with you, or continuing seeing you on a semi-regular basis, depending on how your treatment protocol is set out, well, it's important to understand what happens post-treatment, and that's thought that you need to give right now as a practitioner when you're designing your treatment protocol with them. Yeah. Okay. So now, what you need to know, here's important. First of all, it's first contact. This is where the treatment actually starts. In other words, when people connect with you, right? When people make an inquiry, whether it's going to be an online inquiry, an offline inquiry, whether it's a referral, whether it's somebody just gave you a call, or somebody checked out your website and sent you, I'd like to find out a little bit more about your treatments and what you do. CDC, it's super important to ask yourself, this is where the treatment starts. In other words, the selling process starts here as well, right? You've got to think about this, right? Now, I know what most practitioners say. They carry on about the whole selling thing and money and all the rest of the stuff. Well, to be brutally honest, you need to get over it if that's how you're thinking. Why? Because you've got a family, or you've got to feed yourself and clothe yourself, and most importantly, stay in business. So, it's an exchange of fair treatment for investment that people put into it. So it's about shifting your mindset, yeah? And I'm not going to get into that today. So, but it's important to understand that, this is where the treatment starts, so the first contact. So what you're going to be asking yourself is, will you send information prior to that consultation? Is that something that you want to do? So somebody makes an inquiry, yeah, they're happy to go ahead, so you book them in for an appointment, and will you start to send information prior to that consultation? Here's where a lot of practitioners stop. What they do is they go, yeah, cool, you can book in for a treatment, and then, I can't see you for another 3 weeks because I'm either too busy or I'm too lazy, one or the other, right? And they the client comes in, and from the time where the clients come on board, or made that inquiry because they're interested in getting help from you, most practitioners don't do anything. They don't send out anything. They don't put them into their email sequence. They don't give them a call to see how they're going. They don't do any of that stuff. So it's really, really important. So for you, what's it going to look like? Right? Will it look like that you've got paperwork, you've got a video, you can send email, you can send hard copy, you can give them a call. These are all just simple strategies that you're able to use, right? And what I mean by video, by the way, is you could have a set of videos that you've already recorded just to explain roughly what the treatment's going to be like, or you could have case studies of other clients that have had the treatment with you. So you're talking about, here's what this client came in with, similar to what you're needing help with, and here's what we did. This is what to expect in our treatment, right? Here's how it's going to go. So you're basically giving them a heads up. Could it be that you're sending them out some, a series of emails? Say, check out this research that was really good, or have you ever thought about using this style of nutrition, or if you've got an injury, maybe you can rehabilitate it like this. By the time you get to us, hopefully it'll be in a better position, and then we can help you from there, right? Do you send out maybe a book that's hard copy? I mean, there's really up-to things that you can do. Yeah. So it's important to ask yourself, how do you go up? Now, next thing is, how long from the inquiry to the consultation? This is really important. So are you spending, is it weeks and weeks, or is it months and months? Well, I have to tell you, if it's like that, A, you need to get more staff on, so people can come to see you quicker than that, or B, maybe you need to look at diary management, because somebody that makes an inquiry then can't see you for 3 months. I mean, ultimately that's a disservice for the client and a disservice for you, to be brutally honest. Yep. Now, I know of practitioners that go, I'm in such demand that it's this. Well, that means that you're not leveraging who you are and or your business correctly. Yep. So it's important to understand what's the best way for you to make sure that, from inquiry through to consultation is reasonably short. And by reasonably short, I mean, a week or under. Yeah, because people are in pain. They need to see you now, regardless of whatever your type of practice the type of practitioner that you are. Yep. Okay. Now, so what I've done is I've put together ultimately. I've put together here a treatment funnel design, and here's what I mean by this. So now, this is a rough guide, okay? But what I wanted to show you is, a typical treatment funnel design that I've used before in my clinics and with my clients that seem to work beautifully. This is only one part of the component, because we spoke about, how do we put a treatment protocol together, and I'm showing you this now. So think about it like this. So there's an initial inquiry. Okay, so clients, so you get at the initial inquiry, you obviously need to get information like, name, email, maybe date of birth, address, phone number, everything, that's the standard email, like the initial inquiry. You need to get obviously contact details, what the best contact details are. You need to book them in, so you need to calendarize the appointment, right? So you've got all that. And then between that comes step two. So what we do is I like to send out paperwork. And by that I mean it could be an intake form. You could be asking them for a diet sample. You could send out some paperwork, as we said before, that's, something that is of educational purposes. So it depends on the style of practitioner. So as an example, so if you're a naturopath, as an example, where you could say is to go, here I've got a health appraisal questionnaire, or HAQ as we all know it, with I'd love you to fill that in and scan it and send it back to me. Now, why would I want to do that? Ultimately for two things. One is then I've got the results. I'm able to, at the examination phase of the initial inquiry, I'm able to look over any of the paperwork that they've sent through. And number two, it cuts down on time, obviously, because if they've got to fill all that stuff in while they're there, it's kind of a pain in the ass. And then the third component is, guess what? It makes them accountable for it. So if they've got paperwork that they're sending you and they've already got, all the paperwork filled in and they send that back to you, obviously that means that they've started the level of accountability. Now, is that patient going to be a better patient for you? I believe so. I've proven it, over thousands of cases that I've worked with over and over again. If you set up that treatment protocol, and they, do the initial paperwork and they send it back to you, or they bring whatever they need to the session, straight away, that client is, usually not a time waster, and they really will be. Okay, so there's many different pluses for you sending out some level of paperwork prior to them, and them having it ready for you either at the session and or at send that to you before. And then you go to phase 3, which is the examination. So at the examination, obviously, you're examining whatever that client needs to be. So I'm hoping that you're keeping detailed documentation on that, whether it means that it's testing through biomechanical testing and or any other protocol testing that you usually have. Naturopath terms, sometimes it's a urinary indicator test, a saliva test. It could be a VLA. I mean, there's a lot of different levels of testing that you could do. If you're a personal trainer, it could be length tension ratios. It could be, gait analysis, biomechanical analysis. There's so many different opportunities for you to be able to do what you need to do. Yeah. Now, and then at that initial examination session, what you're doing is you're saying, here are some of the further, tests that I require. Now, that then moves to the second examination. So think about it like this. Very rarely have I seen a client and I've got an hour session, I'm able to do everything that they need to and then give them, the ability to, follow a treatment protocol on the initial session. Why? Because there's too much information. If you're taking a really detailed analysis and understanding what's going on, whether it's client history, health appraisal questionnaires, any of the questionnaires that you need to know, I mean, that's a lot of data. Now, if a lot of clients, if you try to give that all to them in one hit and then tell them exactly what they need to do, well, they get a little bit confused, and it's just hard for them to maintain any level of treatment. Yeah. Now, so I believe then it's important to say, okay, here's our next consultation. Here's what we're going to do. We're going to be able to go over the results that we've got back from any of the further inquiries. I'm going to give you a treatment map, and I'm going to suggest a program for you. Now, I'm going to talk to you on the next few slides about, the program versus, just a single consultation. Now from there, here you go. So it starts, treatment 1, I need you to do this. Treatment 2, I need you to come back here. Now, the reason I've highlighted treatment 3 in blue and then treatment 5 in blue is in a lot of cases today, because of the advent, obviously, of technologies like this and like Skype and like GoToMeeting and, a whole ton of online resources, right? What you're able to do is you don't necessarily maybe need the client to come in, right? You're able to speak to them about things that they can do from home, or you can speak to them over, online, that you're able to still set up a 15, 20, 30-minute consultation, and it's online. So what does that do for the practitioner? A, it helps with time management. You don't have to be in the practice. B, you're able to do consults after hours if you like. C, for the client, they don't have to come, find parking and all the rest of the stuff that comes with that. And D, I think, is just convenient for both parties. I mean, if technology's there, why not use it? Now, it's interesting. I've had, people like, osteos and physios go, I really need to work with the patient. I'm like, okay, well, maybe the follow-up treatments don't need to be like that, because, I mean, everybody's got a video camera today, so they're able to, set up on Skype via video cam, and you're able to show people exercises that they can do. Correct it. I've done this many a time. Okay, so what I'm sharing with you is, in a treatment funnel design, you can have that exactly how you want it to make sure that the client's getting the maximum benefit, and you're getting the maximum benefit out of it as well. Okay, so the next component here is I'm going to talk about the treatment protocol explained, yeah? So your program is X amount of treatments. It's important to do that. So as we discussed in the opening phase of this, we spoke about very rarely is a client going to be able to come to you once or twice, and that's about it. And I know I've worked with hundreds of naturopaths, I've worked with hundreds of massage therapists, pretty much every genre that you can imagine I've worked with. And regardless of what it is, I know that, unless, the client's a Superman or a Superwoman, it's very rarely, it's just a one-off, yeah? So you want to be mapping that out for them prior, right? So, coming back to this, it's important when you design this treatment funnel design, you're thinking the end in mind. How many treatments do they need to see me? What's the outcome? How much education do they need? What's going to be post-treatment, right? That all needs to be worked out on this treatment funnel design. Why? Because it's the same as going, to a surgeon. They go, well, here's what we're going to do. You're going to be, in pre-operation, we're going to need to do this. Here's what's going to happen at the operation. Here's what happens on the day. Here's what happens in recovery. Here's what happens post-operation. This is how many times I need to see you. My secretary will book you in for these appointments, and then you're booked in here for this particular surgery or whatever it may be. Do you see? It's all mapped out. Why? Because then for the client, they understand what their movements are. For the client understands exactly how much the program is going to cost. For that, they understand exactly, what level of care that you're able to give them. Let me get you to write that down. What level of care are you giving to your client? This is super important. And, how much effort that you put into this treatment protocol equals usually what the level of care is that they're going to expect, yep? Now, next thing is, there's space like this. So, as an example, if you look at a chiropractic protocol, treatment protocol, usually what you see is a lot of sessions close to each other. So, you come in for 15-minute adjustments, right, and sessions. Usually they're, maybe twice a week, 3 times a week for the first 4 weeks, and then it expands out from there. So what I do suggest that you look at is a chiropractor treatment protocol, and you can have a look at them online, right? So if you Google that, you'll see it. You can check it out. If not, I believe that there's a company in Melbourne that actually sells those charts as well, but I can't remember what the company name is. I've bought charts off them before, yeah? So supplemented with X amount in practice and X amount online, right? We just spoke about that, right? And then this is a support mechanism. So if you need to contact me, you can, connect with me in a private group. You're able to SMS me like this. You can connect with other people, like this, like that, whatever it may be, right? So it's important to have support mechanism. Why? Because I'm not worried about when the client's in front of you. I mean, they're there, and you're a practitioner, so they're in capable hands, I've got no doubt. What I am concerned about, however, is when they leave from you. How do they keep accountable, right? What would be a support mechanism for that client? How about if they're going through, anxiety or depression or anger or fear or whatever it may be, because they're just not quite sure, they're going through pain or they're not feeling too well, okay? Very rarely do you hear of practitioners just calling up their patients after they've come to a treatment just to check up on them. And I have to tell you, it irritates me because I think that should be a part of the treatment protocol as well. So do you see that's mapped in and designed? So people get a really good understanding of the level of care that you want to give. Now, I understand a lot of people, practitioners are time poor. However, it's a 2-minute phone call. You can say a lot in 2 minutes, or an SMS or a private group, and you can definitely cater for the individual number. Yep. Okay. So program versus individual sessions is something that we were talking about. Now, I believe the program allows you to plan and map out treatments for your clients, which is awesome. I believe it creates certainty. Yeah. So when you show somebody a treatment protocol or a program, right, in a step-by-step thing, you should be able to laminate that once you've got that, show it to people. You can have it online. It would be really, really cool, because then they understand what they're expecting, right? So it allows you to map out their treatments. It creates certainty. It increases high probability of healing. I believe that, wholeheartedly, because now they understand what they need to do and how they need to do that with you. It helps you get your results, yeah? Because, most of the times, one treatment's going to be tough, but if they see you for X amount of treatments, that, undoubtedly they're going to do a lot better, yeah? And it creates a great referral tool. Why? Because it means that you're seeing your client on a regular basis. Now, it also, which I didn't put into you, it also helps with cash flow, right? Because, when people are coming, how many sessions they've got, what to expect, how much that's going to be. Now, think of it like this. The reason why, as an example, McDonald's say, do you want a meal, is because they understand that if they sell 4 items for this much and then they upsell that, they know how much they get, right? That's a meal. Not too dissimilar to a program. So with a program, you can say, well, that each patient's going to invest, 5 sessions, they're going to invest, $700 or $800 with you, right? Depending on whatever you charge, right? Do you see? So now you know that every client, equals this. So if you've got your financial budgets, weekly and or monthly, you know how many clients that you need to see, how long they're going to be in the pipe for, right? How long they're going to be in the client funnel, and then you're able to understand what you need to do to rebook them or upsell them or whatever it may be, right? This is obviously thinking as a practitioner and a business owner, right? Both need to be able to work together. Why? Because one without the other, and you're not in business. And guess what? You're not helping them. Right? Now, so I like to say now we're, set and ready to go. So you need to, talk with your patient or client about pricing and investment, right? And you can say, look, it's paid through something like EasyPay, which is a pay gateway protocol, a payment gateway. Check it out. It's called EasyPay. I've used that before. And basically, it's a direct debit system that you can set up. There's a company that does that for you. They get a percentage out of whatever it is that the client pays you, but they're easy. They look up with the client. You fill in some paperwork with them. It's done. You can go through credit card, obviously, or cash. Maybe you might say, here's a little bit of a discount if you pay with cash for the whole payment. So if you, look after the 10 treatments that we need to do, here you go this way. Yeah. Now, there's a difference, by the way, guys, from doing a 6-pack or a 10-pack or whatever, so they can use whenever. To me, that's a ridiculous way to actually treat people. What I think, you're the practitioner. They're listening to you. They've trusted you enough. They've liked you enough. They've, put investment and time and energy to come and see you. So guess what? Do you think that they want you to look after them in the best way that possible as a professional? Absolutely. So why do most practitioners actually send it back to the client? Go, whenever you feel that you need to see me, come and see me. It's absolutely ridiculous. The medical industry would never do that. And this is someone that we're, looking at getting to the level of. Yeah. Now, whatever you believe within the medical industry, it's systems that I'm more concerned about rather than whatever the medical industry is doing. Yeah. So both can work together. So then you can have a calendar of treatment. So then you can say, look, here's what we need to do. with the treatments. Here's your calendar so you know when to come in. We'll set up appointments, right? So you can have that. And you can do this all in, iCal if you've got, Apple, or just, any of the calendar systems that you're using on your computer. You can have it using Windows, like in your email browser. There's a lot of different things that you can do with that. And maybe, with that, what you can do is give them a bonus. So you can say, here's a complimentary gift, for taking the treatments up with us. What we're also going to do is give you, as an example, cross-referral to massage therapist or a beauty therapist, or here's a couple of movie tickets or whatever it may be. It's really good to incentivize people as a bonus. Also, by the way, within your protocol, treatment protocol, what you're also able to do is set milestones in place. So people say, when I get to here and I feel like this, or I reach this, goal, well, then they get a reward for it. So it's an excellent thing, right? I mean, you like getting rewarded, so do I. So doesn't it make sense that your client does as well? So, and guess what? That keeps them on track, because then they've got a goal that they're looking forward to. They do better because they want to please you and they want to please themselves. So it's a win-win all the way around. Yep. Now, here's your job as a practitioner. And the reason why I've written that in capitals is simple. It's your job as a practitioner to get results for your clients. Let me say that again. Your job as a practitioner, number one, is to get results for your clients. Number two is to stay in business. What is it? To stay in business. If you're out of business, you can't help anybody, including yourself. And number three, help as many as you can that want to be helped. Okay? Help as many people as you can. So if you get results for your clients, if you set up a treatment protocol for them, if you stay in business because now you understand how cash flow is working, you've got a system, well, guess what? You can help a lot more people. And really, that's everything that I believe in. This is what I'm doing these programs for all the practitioners for, is to help you stay in business longer so we can heal the pain. And together we can do this, right? So here's what I'd like you to do. I'd like you to design your treatment protocol, and I'd like you to email that to me. Everybody's got my email, so you can email that to me so I can have a look. Yeah, I'd love to hear from you so I can help you more. Yep. Okay. So I hope you enjoyed today's session. I really look forward to seeing you on our next session. So in the meantime, right, anybody can reach out to me. You know where I am. If I can help you, I definitely will. So until then, have an incredible day, and I look forward to seeing everybody on the upside.